Gina geese. The rabies virus travels to the brain before it can cause symptoms. The time between exposure and the appearance of symptoms is called the incubation period. It may last for weeks or months. The first symptoms of rabies may be similar to those of the flu, including weakness or discomfort, fever, or headache. There also may be discomfort, prickling, or an itching sensation at the site of the bite. These symptoms may last for days. The chances of survival are almost non-existent. Hey guys, welcome to my channel, Will I Survived? In this video, we will discuss Gina geese's case, which shocked the world and opened new doors for science. Don't forget to smash the thumbs up, share, and subscribe to the channel to see our latest content. Gina geese loved animals, especially wild animals. In 2004, Geese, then 15 years old, picked up a bat she found in St. Patrick's Church in her hometown of Fond du Lac, Wisconsin. It was fascinating to see the bat up close. The bat was scared and bit her left index finger, and he struggled to be free. She went home and told her mother about the bite, who didn't find the wound severe, so she decided to treat it at home and not seek medical attention. She treated the wound with hydrogen peroxide. The first week went normally, and nothing seemed dangerous. 3 weeks later, Gina began to feel exhausted with double vision, vomiting, and tingling in her left arm. Her parents began to worry and decided to take her to the hospital. During the examination, it was discovered that Geese had developed symptoms of rabies. She was referred to the Children's Hospital of Wisconsin in Wauwatosa, Wisconsin. Doctors there began to suspect rabies, and laboratory tests confirmed their diagnosis at the Centers for Disease Control. It was too late for the anti-rabies vaccine cocktail. Instead of giving her the hands of death, the doctors decided to shut the brain down and wait for the cavalry to come by, inducing a coma to give her immune system time to build antibodies against the virus. It was an unproven combination of drugs that had never been tested before. An infectious disease specialist who treated geese at the Children's Hospital of Wisconsin in Milwaukee, Dr. Willoughby, devised the treatment credited with saving geese there, which has since become known as the Milwaukee Protocol. Initially, it seemed nearly impossible for geese to survive, but at least they wanted to try and save her. The therapy was attempted, and they knew that if it didn't work, it would damage her brain. But Dr. Willoughby believed it was the only chance doctors had of saving her. Geese couldn't talk, sit, or stand and fell in and out of consciousness. She also needed to be intubated to help her breathe. She was critically ill and looked as if she might die within the day. Doctors gave her the antivirals ribavirin and amantadine. After about a week, they tapered off the anesthetics when tests showed that Geese's immune system was battling the virus. For about 6 months after awakening from the coma, physicians also gave her a compound called tetrahydrobiopterin, which is chemically similar to the B-complex vitamin folic acid and may improve her speech and ability to eat. Physicians gave her the supplement after tests showed that she had a deficiency of the compound, which is known to boost the production of serotonin and dopamine neurotransmitters needed to perform motor, speech, and other routine bodily functions. Remarkably, Geese survived. She recovered most of her cognitive functions within a few months and other skills within a year. She got her driver's license and is now a sophomore at Marian University in Fond du Lac, majoring in biology. Despite surviving the devastating disease, Geese has lingering signs of illness. Geese, once an avid athlete, now lists to one side when she runs and walks and no longer plays volleyball, basketball, and softball as she once did. She speaks more slowly and sometimes not as clearly as before her illness, but these effects may fade over time. She is pretty much normal and continues to improve. Rabies has an incubation period of 2 weeks to 3 months and kills within a week of the symptoms showing up. The vaccine series and other immune therapies are useless at this point and may even speed up and increase the severity of the symptoms. Patients are made as comfortable as possible in the hospital and later sent home to die an agonizing death. Over the past 4 years, the Milwaukee Protocol has been used to differing degrees a dozen times, but until now, Geese was the sole survivor. Antiviral drugs and immune therapies, including steroids, disease-fighting interferon alpha, and poly-IC have been tried, but none are life-saving. Rabies kills by compromising the brain's ability to regulate breathing, salivation, and heartbeat. Ultimately, victims drown in their spit or blood or cannot breathe because of muscle spasms in their diaphragms. 1/5 die from fatal heart arrhythmia. Doctors believe that Geese might survive if they suppressed her brain function by sedating her. while her immune system attacked the rabies virus. In a 2005 report on her case in the New England Journal of Medicine, Willoughby speculated that she might have been infected with a rare, weakened version of the virus. Today, chalks Geese's survival up to aggressive intensive care, the decision to sedate her, and 10% sheer luck. Which element of that combination made the difference? And whether the antivirals she was given helped save her is unknown. In all honesty, we were probably just pretty lucky, he says. Only another survivor and then animal and clinical trials. We'll show if the therapy works and why, he says. The U.S. Centers for Disease Control and Prevention (CDC) plans to test the protocol on rabies-infected ferrets. Thai and Canadian doctors who unsuccessfully treated a 33-year-old man with rabies with the Milwaukee Protocol recommended in the Journal of Neurovirology 2 years ago that physicians exercise caution in using the treatment because it is too expensive and lacks a clear scientific rationale. Willoughby says it cost about $800,000 to treat Geese. 4 years after she nearly died from rabies, Gina Geese is heralded as the first person to have survived the virus without receiving a preventative vaccine. But Geese says she would gladly share that honor with others if only doctors could show that the treatment used to save her could also spare other victims. They shouldn't stop till it's perfected, said Geese, now 19, during a recent interview about physicians' quest to refine the technique that may have kept her alive. Another girl infected with rabies is still alive more than a month after doctors induced a coma to put her symptoms on hold, just as they did with Geese. Yolinda Caicedo, an infectious disease specialist at Hospital Universitario del Valle in Cali, Colombia, who is treating the latest survivor. The victim is an 8-year-old girl who came down with symptoms in August, about a month after a rabid cat bit her. Caicedo said that the family had sought treatment for the bite in Bolivar at a hospital about 3 hours by foot from their rural home, but that the child, Nelsie Gomes, did not receive the series of vaccines that can prevent the virus from turning into full-blown rabies. The 5 shots contain minute amounts of the deadly rabies virus and are designed to nudge the body into developing antibodies to fight it. Patients are also given immunoglobulin shots to protect them while their immune systems produce antibodies to the vaccine virus. But the combination is only effective within 6 days of infection before symptoms show up. Caicedo is hopeful but indicated that Gomes would face a long, slow recovery. She would not say how long Gomes had been in a comatose state, but she had been awake for a few days and was stable. The child can move her fingers but cannot walk or eat on her own. Her eyes are open but she cannot speak yet, and physicians are not sure if she can see, Caicedo says. Geese was the keynote speaker at a conference last week in Atlanta, where scientists gathered to discuss the latest research being conducted on ways to battle the deadly disease. During her talk, she urged physicians to continue efforts to pin down treatments that work. Rabies is 100% preventable with vaccinations if patients receive them before the onset of symptoms, including hallucinations, delirium, muscle spasms, paralysis, and hydrophobia. Yet, an estimated 55,000 people, mostly in Asia and Africa, die from it annually because of misdiagnosis or because the illness is not recognized until it has taken hold, according to the journal Neurologic Clinics. Often, patients dismiss the potential seriousness of bites, cannot afford follow-up medical treatment, or in some situations are unaware they've been bitten, as was the case of a 13-year-old Connecticut girl who died of rabies in 1995. Vaccine shortages as one manufacturer, Bridgewater NG-based Sanofi Aventis, upgrades its factory to meet U.S. Food and Drug Administration requirements, and chronic shortfalls of immunoglobulin also play a role in the fatalities. The vaccine immunoglobulin regimen costs $1,200 to $2,000 in industrialized nations and $100 to $300 in developing countries, an out-of-reach sum for many people, Willoughby says. Geese says that the 4th-year anniversary of her illness has brought up some bitter memories that she will probably never shake, but she is glad to be alive and doing as well as she is. It takes some getting used to, but I've kind of come to terms with the fact that I'm the only survivor, she says. At 15, I never would have thought that anything like this would ever happen, and that I live is just amazing. An animal lover who owns a dog, 2 rabbits, and 6 birds, she hopes to one day open a sanctuary in Fond du Lac for endangered animals, including big predators like lions and tigers and wolves, and maybe even bats too. I'm not scared of them at all, he says of bats. I'm more passionate about animals than I was before. Animals are my happiness and reason for living. That's a wrap for today. Don't forget to smash the thumbs up, share, and subscribe to the channel to see our latest content.